AllOnX procedure is basically placing implants at a certain location in your bone and fixing teeth into them so that you can have fixed teeth, or you say permanent teeth. People say
Nothing
that.
to take in and out is
no.
what people would call permanent.
Yes,
yeah.
permanent. So it's an implant-supported fixed teeth system. And AllOnX, because it's all started with All-on-4, that 4 implants are good enough to hold all the 12 teeth. But studies came out, yes, everyone is different. We cannot have, one nail and hammer it all. No, we have to take into account on patients' height, weight, chewability, muscles, how much force they're going to generate, right? Depending on that, number of implants in the bones are decided. So bones, actually height, weight, bone dictates how many implants or foundation is needed.
I see.
For example, a beam of a building, right? How much beam you need depends on how high you're going to go.
Right.
So in the mouth, how much loading it's there, we call it loading when we bite on it. How much loading is required or necessary, that's how we created a number of implants. That's what they start calling as AllOnX.
I see.
Not a specific number, 4 or 6.
I see. So meaning that it could be anything.
Yes, it could be anything. And it all depends, because implants and teeth are not just in your mouth. It has to take an account of your whole body, right? It's different for a 35-year-old big build than a 75-year-old not that big build.
So there's a lot of design in how many teeth will be implanted then?
So the implanted are the implants. The teeth are fixed on top of that. It's usually 12 teeth at the top and 12 teeth at the bottom.
I see.
The idea is to get the first molar, because beyond that, the functional capacity is increased. And those are for people who have bigger jaws, then we can go beyond that as well. But usually 80% of the times, 12 teeth at the top and 12 teeth at the bottom with first molar suffices, because first molar is a crucial bite point in our mouth, where when we chew, that's the place we usually chew. Anything behind that depends on the jaw size and person to person.
I see. And who's mostly a candidate for AllOnX?
Pretty much anyone who is looking for fixed teeth, who's looking for a better life in chewability and do not want to think about dentures anymore, is a good candidate if they have a good bone. And that's how we need an evaluation, that they have sufficient bone to receive that. Now, they could have the best bone. They could have the least bone. There are surgeries and solution for every type of bone, most of the bone, until they're medically compromised or medically contraindicated. But the complexity of the surgery increases as we lose more bone. That's why catching it early is always better than catching it late. Risk to benefit ratio. That's how we gauge it. If you have bad teeth, they're not restorable. You have teeth in your mouth, but those teeth are beyond restoration. They're so decayed, but your bone is good enough. Then we don't want to risk bone to keep teeth in there and take a benefit, rather than take the teeth away and take the advantage of the bone and give them the teeth.
Because dentures are such a process and like a daily kind of hassle for people. Yeah.
Imagine running in loose shoe.
Right. Yeah, that's a good analogy. Yeah.
You cannot run all the time. You're going to think about keeping the shoe in place rather than running. Similarly, when you have denture, all the time you're just focused on keeping the denture in rather than focus on chewing.
Right. Yeah.
Chewing
is kind of important. Eating is kind of important.
Yes. So purpose is beaten.
Yeah.
So dentures were there when the technology wasn't there. Now the technology has advanced so much that today you can walk in an office which is capable enough without a teeth or bad teeth, and you walk out with fixed teeth the same very day.
That's amazing.
You are functional the same very day. However, your bite forces, your soft tissues, your change, it will come gradually because it's a healing process. The day one is mechanical. But at least you're healing with a functional teeth in your mouth. You're not sitting around for months and months without teeth to get healed and then implant and then teeth. No. The same very day, you become functional, and you're going to improve from day one until the next day, upcoming days.
Nice.
So that's the beauty of technology. And in our office at Elevate Dental, we're fully loaded with all the updated technology. We have in-house printers, CT scans, and all the stuff. So we do everything in-house. So we are capable.
And that's some pretty quick satisfaction.
It is. I'm telling you, it's so rewarding. Even as a clinician, I cannot imagine what I'm giving to them. And they come up with the stories later on, what they felt and what they're feeling. On the day one, they're so shying away, They're hesitant, and I agreed. And I never judge, and we should not judge, right? But when it's done, then they tell stories down. And there's some cute stories out of that.
Yeah.
And some of my patients told me that his nephews were not coming close to him.
Yeah.
And once they get the teeth, they're so beautiful that they start coming. His nephews start coming closer to him and start playing with him. That's his happiness, right?
Yeah.
That is something I could have never imagined. I'm giving that to him.
Sure. Yeah.
That's my gratification. That's my, I think, the highlight of the day. So there's several stories, and you don't know the underlying stories.
Yeah.
It's amazing.